Welcome to the Cost-Sharing Roundtable. For those of you who don't know me, I'm Amy Niles, and I'm Vice President of External Relations for PAN. Thank you all for attending today and spending your Friday with us. This is the third annual Cost-Sharing Roundtable hosted by PAN in collaboration with the American Journal of Managed Care. And this year's theme is the Patient Assistance Safety Net: how many need help, how many are helped. For those of you who may be tweeting in the audience, please use hashtag CostSharingRoundtable. Today we'll hear about the challenges associated with cost sharing for patients, for their providers, and the healthcare system in general. We'll explore short and long-term policy solutions that could mitigate the out-of-pocket burden for individuals. Recently, there's been heightened attention on cost sharing, patient assistance, and healthcare spending among policymakers. So we think this roundtable is very timely. It remains unclear, however, in this very uncertain environment, if policy solutions, such as placing a hard cap on out-of-pocket costs above the catastrophic limit, will move forward. For the many patients not reaching the catastrophic coverage phase, will cost sharing continue to be a burden? We think so. We believe that, at least for the foreseeable future, the challenges that patients are experiencing accessing and affording needed medications will continue. And the number facing these challenges, many of whom, as you know, are living with multiple chronic conditions, will continue to rise. There'll be more and more people like Ted, the little guy in your infographic in your packet, who's a Medicare beneficiary and needs medically necessary treatment prescribed by his provider. Ted is on a fixed income and cannot afford hundreds, let alone thousands of dollars to cover out-of-pocket costs for medications. He cannot afford the $6,300 in annual out-of-pocket costs, and he can't afford paying 40% of that amount in January alone. In late fall of 2017, PAN worked with patient advocacy groups, many of which are in the audience today, to survey individuals about their out-of-pocket costs for medications. And what we found was nearly 4 out of 10 individuals could not afford out-of-pocket costs for medications. Probably not a surprise to any of you sitting here today. However, when we dove deeper, we found that those living with cancer or other chronic illnesses like multiple sclerosis virtually could not afford any of the costs. Of those unable to afford out-of-pocket costs, about 70% were concerned about financial hardship for themselves and their families in the future. About 20% of individuals didn't even look for assistance. And the reason why? They didn't know assistance existed. So we all have a lot of work to do. We're grateful for your being here. We need our collective voices to continue to advocate for improved access and affordability for patients. I'd like to thank our sponsors for supporting the roundtable. A very special thank you to our silver sponsor, Onco360, and thank you to all of our bronze supporters, Conquer Cancer Foundation with ASCO, CoreSource, Diplomat, District Policy Group, Drinker Biddle, Pharma, Simpson Consulting, Shaner & Lubitz, and Summit Business Technologies. We're very grateful that the American Journal of Managed Care has been our roundtable partner for the past 3 years. I'm particularly appreciative of the support from my colleague, Surabhi Dangi-Garimella, who has been there every step of the way, always putting forth great ideas for educating our respective communities about patient assistance. Surabhi is Associate Editorial Director for American Journal of Managed Care Managed Markets Network, responsible for 4 print publications and 2 digital platforms, including those of the Journal. She earned her doctorate in pharmaceutical sciences at the University of Maryland and completed postdoctoral work at the University of Chicago. Please join me in welcoming her.
Thank you, Amy. Good morning, everyone, and welcome. As Amy pointed out, this is our 3rd year for AJMC collaborating with the PAN Foundation The conversation over the past 2 years and this year as well remains, how can we improve patient access to much-needed care? This year, we challenged our researchers to provide an estimate of the financial assistance that patients need so they can cover their out-of-pocket costs, as well as the size of the safety net that we have available. Congratulations to the winning team from Tulane University and the runner-up team from Fred Hutch and the Navictus Group. We look forward to your presentations today, as well as the thoughtful discussions that the day has planned for us. I would now like to invite Dan Klein, the President and CEO of PAN Foundation, on stage. Dan has been associated with the healthcare industry for a while now. He spent over 35 years in the health IT space. In his previous position at the Cystic Fibrosis Foundation, Dan was the Senior Vice President for Patient Access Programs. And now at PAN, he has continued the mission of leading the efforts to raise awareness around challenges that patients face to cover their out-of-pocket costs. And he's also drawing attention to the help and support that organizations like PAN provide to these patients. So Dan.
So thank you, Surabhi. And once again, welcome to PAN Foundation's and the American Journal of Managed Care's third annual Cost-Sharing Roundtable. Before getting started, I'd like to thank all of you for attending today's roundtable. And certainly throughout the day, I really encourage you to participate in the discussion. Of course, I want to thank our partners and our sponsors for making today's roundtable possible. And I especially want to thank Amy Niles, who has put on a great event today, and I think everybody will be excited about the program. Unfortunately, even after 3 years of hosting the roundtable, cost sharing remains a serious and growing problem, especially for people on Medicare who have life-threatening, chronic, and rare diseases. Out-of-pocket costs are increasing for many beneficiaries, Medicare beneficiaries, both in terms of the percentage that are paying more than 20% of their income in out-of-pocket costs, and in the numbers that are reaching the catastrophic threshold. Given the complexity of the issue, it's easy for policymakers to lose sight of the day-to-day challenges that face people with serious illness, getting access to their critical medications. At the PAN Foundation, you can imagine we get calls every day from people who really can't afford assistance without, afford to get their medications without the assistance we provide. And it can be as little as $50 in an out-of-pocket cost that prevents somebody from getting a critical medication. So again, policymakers particularly need to think about the pragmatic issues facing patients. The reality in Medicare is that even though the number of non-low-income subsidy patients who reach the catastrophic threshold has more than doubled in the past 10 years, it's now over 1 million patients, really only a small percentage of Medicare patients reach the catastrophic threshold. 2% of the patients on Medicare reach the catastrophic threshold. So while a hard cap on out-of-pocket costs above the catastrophic threshold is important, it really won't solve the problem. And I think that that's what's concerning us, that policymakers may think that a cap on the catastrophic costs is a silver bullet, but it really won't be. Many of the patients that we deal with can't afford the annual deductible. They can't afford the 25% cost sharing during the initial coverage period, and they can't afford even the discounted cost that they pay during the coverage gap. We need to keep in mind that over 1/3 today of Medicare patients are spending more than 20% of their household income on health-related out-of-pocket costs. And that number is projected to grow to over 40% in the next decade. So that's sort of a daunting number, that 40% of people on Medicare could be spending more than 20% of their household income annually on health-related out-of-pocket costs. So capping out-of-pocket costs at the catastrophic threshold is certainly going to be a huge help for some people, but it is absolutely not enough. Two other policy recommendations that PAN supports are, one, finding ways to spread the out-of-pocket cost burden more evenly throughout the year. We think that's critical, that patients who might be able to cover their out-of-pocket costs if they're spread out, unfortunately don't even pick up their medication with the seasonality that they face when the benefit year renews now. Number two, we think it's important to ensure that every indication, every clinical indication, has at least one highly effective drug that's not on the specialty tier and not subject to a 25% coinsurance. So those are two additional policy recommendations that PAN supports. So it seems unlikely that the need for patient assistance will go away before next year's roundtable. I'm assuming Amy is up for doing another roundtable next year. And in fact, the numbers indicate that many seriously ill Medicare patients will still need help paying for their critical medications, even with the cap on the catastrophic costs. Before moving on, I want to also draw everyone's attention to the fact that high deductible health plans and growing restrictions on the use of commercial copay cards and coupons, such as accumulator adjusters, are putting more pressure on commercially insured patients as well. And inevitably, these patients are going to look to charitable foundations like PAN for help with their out-of-pocket costs if they can't get help from coupons and copay cards. So with that framework in mind, I would like to introduce our keynote speaker, who is an expert on financial hardship, the economic burden of cancer in particular, and patient and provider factors associated with quality of care. Dr. Robin Yabroff is an epidemiologist with more than 20 years of health services research experience. As Strategic Director of Economic Burden of Cancer at the American Cancer Society, she leads research on financial hardship and the economic burden of cancer. Dr. Yabroff previously held positions at DHHS, at the National Cancer Institute, and the Lombardi Cancer Center in Georgetown. She earned her PhD in epidemiology from the Johns Hopkins School of Hygiene and Public Health, now the Bloomberg School, and received an MBA from the University of Rochester. Dr. Yabroff has co-authored over 150 peer-reviewed journal articles and other publications. She is an associate editor for the Journal of National Cancer Institute and on the editorial board of the Journal of Cancer Survivorship. In addition, Dr. Yabroff has received multiple National Institutes of Health Merit Awards for her research leadership, and most recently she led a multi-institutional collaborative effort to improve publicly available data for estimating the burden of cancer in the U.S. through the development of the Medical Expenditure Panel Survey Experience with Cancer Survivorship Supplement. So hopefully I haven't done anything too badly to damage Dr. Yabroff's curriculum vitae, and I'd like to welcome her to the stage.